slides. Please just feel free to chime in. This really was designed for tips for celebrating Halloween in patients with diabetes, and it is geared more toward a younger population, so children trick-or-treating. However, I think this is such a great resource for everyone. And so even though some of my slides may speak to, children or youth trick-or-treating here and there, I think that this is generalizable to really all of us. There's a lot of good learning points throughout the slides. So we'll move on to our first slide. So it's really important to plan ahead. You want to make sure you sit down with your child and discuss Halloween plans in advance so that they know what to expect. Create some boundaries and general rules and involve them in the decision-making throughout the festivities. They'll be much more likely to be on board with a plan that both you and your child create. And find out what's most important to them about the day and try to work together to meet in the middle so that diabetes management can still remain a priority throughout Halloween. Next slide, please. You want to prepare activities that don't involve food. So taking the focus off of candy by encouraging arts and crafts, pumpkin carving, painting contests, watching Halloween movies, or going to haunted houses or having hay rides. This is all a great way to create memories that don't involve food. Next slide, please. And then you can consider participating in TEAL Pumpkin Project. The TEAL Pumpkin Project, it's through the Food Allergy Research and Education. And its idea is to raise awareness of food allergies and promote inclusion of all trick-or-treaters. And so you can do this at your house by handing out non-food treats such as bookmarks, stickers, or glow sticks. And this is a great option, not just for food allergy families, but also anybody that wants to be inclusive of all children and celebrate the holiday without too many sweets. In order to do this, they recommend that you have this teal pumpkin outside of your house or your business, and that is the sign for children that there is handouts other than candy. And so that's an example right there on the right-hand side of there's free printable slides and things that you can hang up outside of your business or house that's a teal pumpkin, or you can also paint a teal pumpkin to signify that you give out non-food treats. Next slide, please. So there's also a tip of avoid snacking on candy until you get home. So planning on trick-or-treating, you want to make sure your child eats smart and throughout the day, earlier in the day, so that they can start off the evening with a normal blood sugar. And then have a discussion with your child to try to avoid snacking until you're both home from trick-or-treating, which as a parent myself, I know that these things are really challenging to do, in kids trick-or-treating, but I do believe that if you talk through it and have a plan first, that always helps with children. So just kind of set the precedence of, okay, we can go trick-or-treating, we can do that, but we will take our candy home and wait until we're done trick-or-treating before eating and make sure we're not eating as we go. And then once you've returned home, you and your child can help dose the correct amount of insulin to cover carbs in the candy that he or she is about to eat. Next slide, please. I really liked this slide because if you notice in all the treat bags, they don't give you carb counts on individually wrapped candies, like little Snickers and that sort of thing. And so you can find carb counts for all popular Halloween candy here. And I posted the link there as well. If this is hard to read, the link is off to the left-hand side. It can be found at the diabetesforecast.org. So you can look at the exact calorie count, fat count, and carb count in the most popular Halloween candies that are sold. Next slide, please, Mithra. You can use candy to treat a low. So keep your non-chocolate candies that can be used to treat future lows and stash them somewhere safe, like Starbucks or Skittles. You can divide them up into servings of 15 grams of carbohydrates and bag them individually. And we say 15 grams of carbs because, just to refresh your memory, when we have a hypoglycemic event, that's defined by a blood sugar less than 70. And the way that we recommend treating that is to ingest 15 grams of carbs, which is typically a small piece of candy or some glucose tablets. If the person is still able to chew and they still, have mentition, they're still conscious. And so this is a great use for candy to store it aside for lows. And then you want to keep it in easy to reach places like, your child's backpack, bag, or car. According to the ADA, chocolate and other high-fat treats don't work as well for treating lows, so they can be set aside for purposes other than treating lows, for other, snack times or treats throughout the next couple months. Next slide, please. And then limiting pieces of candy per day. So teaching moderation is important. It's not good for anyone to eat too much candy in a day. So setting a rule as to how many pieces of candy your child can eat a day, as long as their blood glucose isn't high, and then really sticking to it. And then you want to apply this rule to everyone in the house, not just the child with diabetes. So everyone is really learning how to eat candy in moderation. Next slide, please. And then also trying to select your favorite candy and ridding the rest. So have your child pick out their favorite piece of candy and try to get rid of the rest. Your child can enjoy a few pieces throughout the week, and you can use it as an opportunity to show them how to cover carbohydrates with insulin. And again, applying this to all children in the house so that a child with diabetes doesn't feel singled out. Next slide, please. I really liked this slide as well. These are options for donating extra candy. So you can donate extra candy to the listed options below. There's different community groups in every community, but just some suggestions are local children's hospital. There's also troops overseas through the Halloween candy buyback program. This is a program that allows children to turn in their candy to participating dental offices throughout the country in exchange for a goodie bag or another prize. And it's also great ways to get your child excited about giving back and volunteering. Some nursing facilities will take candy as well. So just kind of looking throughout your community for people that do take donations of Halloween candy. Next slide, please. Making a trade. So allow your children to trade pieces of their candy for something else that's not food related. So such as a movie ticket, trip to the zoo, a new toy, money, or a gift card. And so this is helping to redefine the word treat. Next slide, please. So all of the available material that I covered is all referenced from one source, and that's from Medtronic. You can find it at the website that's listed there. I highly recommend it, and I also print this article, the 9 tips for celebrating Halloween with diabetes, and you can give this out in your clinics or business, establishments to help both children and adults kind of prepare and celebrate Halloween a little bit differently than we know it, but celebrating it, also celebrating, but without candy per se. So you can find all that material there if you'd like to reference it and print it. Any questions for me?
Thank you so much, Dr. Giordano. That was awesome.
Of course.
The buyback program was so interesting. I've never heard of that, but that's really cool that they have that implemented, and the nutrition facts too. It's with the fun-sized candy pieces, because like you said, those individual ones don't ever really have those nutrition facts. So
yeah, it makes it really challenging to And I think honestly, with trick-or-treating or eating out in general, it's really a challenge to accurately count carbs. I find that that's one of the most challenging aspects of diabetes, and there are definitely apps that help with that too. So I give my patients suggestions of like MyFitnessPal or the Calorie King app, but even those, it's not always easy to enter in these like tiny bite-sized pieces of candy. And so I think that's a really great resource for carb counting outside of apps and what we have just available that we typically recommend.
Yeah, absolutely. Thank you. And I'll be sure to attach your PowerPoint in the recap so everyone has access to those links and everything too. Were there any other questions or comments, Donna or Dr. Patel, you guys wanted to share with the group or ask Dr. Giordano?
Donna,
Look
I
at the
can't
calories,
hear
but
you.
really, we didn't have diabetic children. I have 4 children. Oh, sorry. Not sure. I might be my computer. I'll get closer. But we always did it for the safety, you know. So I think even if you had a diabetic child, you're stressing the safety of checking the candy first. So then that kind of puts it in a different perspective, that it's not that they aren't allowed because of the diabetes. So that was one of the things that I took away from that, because we always did that for our children and now our grandchildren, and so I think that helps. I don't have diabetic children in my I have a diabetic adult, so we will instruct some of these rules with them.
I really do feel like they're good rules for all of us. I do try not to make it so that it sounds like we're singling out one child, because I really do think that that's isolating, and you know, we can all learn from eating in moderation. You know, these rules are great for all of us: eating in moderation and saving some, putting it aside, or using it for emergencies. I think there are a lot of really great tips for all ages, and whether you have diabetes or not.
I was the oldest of 9 children, and we trick-or-treated in
Wow.
about 5 different neighborhoods because we lived in the country, so we took advantage of coming into town. My mom put a lot of it in the deep freeze. We had candy all year long.
Wow, 9 children. That's incredible. What a woman. That's amazing.
That is awesome. Dr. Giordano, I have a question for you.
Yeah.
What would you recommend for kids as far as if they were in school or something and they see their peers with all these candies and things like that? I know
Yeah.
we were saying with like the singling out aspect, how would you sort of recommend that aspect of it?
Yeah, I think it's hard to generalize to all schools, but I think so coronavirus has been devastating in so many ways, but there are some things that have changed in coronavirus times that have also changed the way that things are done at school. I know with my children's school, this year they eat their lunch at their own desk, and so it's much harder to share candy, and they're not allowing treats to come in from the outside. And they had actually stopped doing like birthday treats and that sort of thing from parents even prior to coronavirus, because of all the allergies that have come up in recent times, you know, peanut butter and that sort of thing, which I liked, because having non-food as a celebration is a really great way to teach our youth that, you know, whenever we want to celebrate, we don't have to eat a cupcake, which is so unhealthy. You know, a cupcake or a piece of cake is great for a very special occasion, but that's all it should be, you know? And so every time there's like, you know, a party or parade at school or a special day, eliminating all that time throughout the year, which could be, you know, 15 parties a year where they're having, or even more if they're celebrating birthdays too, where they're having cupcakes and cookies and treats. And so our school has moved away from doing that. And I do, you know, if you're a parent or, you know, you have children in your family, I would say encouraging their school to be proactive about not allowing us to be able to bring in donuts and treats and all these types of things, and to celebrate with non-treat items to teach our children that, you know, it is healthier for us if you get a bookmark or, you know, a free day in the library instead of a cupcake for doing good deeds at school. And so I think that in addition to coronavirus has really been cutting down, you know, on the amount of candy that schools do pass out. So I think that's been a really great thing out of the coronavirus. I know there's not a lot of great things, but I do think that's one great thing. Kids packing their own lunches and eating at their desk and not sharing candy, or even some schools have like candy carts. And in coronavirus, you know, that's not an option anymore to have people passing around and going around with candy carts, which, because I'm a diabetologist, I'm so happy to hear that, even though it's for coronavirus and not really necessarily for high sugar.
Yeah, no, absolutely. That's a great point with those non-treat options too. So Donna, was
Yeah, they have a lot of great things in there about like stickers, glow sticks, even things like going to the library for a party instead of having a cupcake party, or, you know, going outside to read for recess instead of eating cookies, or watching like a fun movie in the classroom. There's so many alternatives so that we can teach our youth that, you know, eating right is a priority, and celebrations don't have to include high sugar treats.
I worked for Head Start for about 10 years, and that was early Head Start and Head Start, so 0 to 5. And I know we did a lot with the food. We stopped having any kind of treats come in because of food allergies, also food safety. You didn't know how long it had been in the car and that sort of thing. Now, for birthdays, what we did is once a month, the cook would make like an angel food cake or something. But we did encourage parents, if they wanted to celebrate with their child, to come in and read a book for the classroom, and then that book would be donated to the classroom in honor of that child. And the kids at that age especially really liked that. I don't remember what we did for Halloween, because I know we did. I was a nurse for them, so I wasn't in the classroom each time. But I know, you know, we did do the parties. But I think the same thing. And being in Head Start, we did get a lot of things like backpacks and stuff like that donated. So that might be the treat that they got to have that day. And like you said, a special movie or something, and they could be in their costume. But we did try not to make reward or punishment, so we kind of moved away from that.
Absolutely. I think that's so important. You know, when people tell me, so I'm an adult endocrinologist, but I've always had a passion for like doing nutrition and education in youth, to try to work more towards prevention of diabetes. And in all of my experience, I feel like prevention really occurs at, you know, when you come out of the womb. Like, it occurs at such a young age, and all the factors in your household. And that led me to do this project called the Lunchbox campaign, which we would go into schools and try to teach children, you know, if you have a choice between eating an apple or a bag of chips, why would you choose the apple over the bag of chips? And it was really fulfilling and rewarding in so many ways. But I found that the limitation of that was that, you know, children are so restricted by what their parents bring home and have for them to put in their lunchbox. And so to reach, you know, you can reach the child in the classroom, but it goes so much deeper into reaching communities and education and so many different things. And I think it's really where the solution to diabetes and the health lies, is to really educate people that, you know, instead of a lunchbox having like a brownie and a donut and a cupcake, it really needs to have nutritious foods, you know, and it's just so important. I wish there was a way to more easily change everyone's lunchbox, but I've tried that. It's incredibly difficult.
We as Head Start, we did provide the food, and one of the things, and it kind of goes along with the diabetes, it was obesity. We started seeing a huge increase in our children. So one of the things that we used to do is serve family style, and the children learned how to do family style. I remember being in the classroom the first day of school, and a new 4-year-old was in there, and he just took the spoon out of the serving dish and put it in. Of course, all that had to go back to the kitchen. But by the next week, I visited again, and they had learned that, as well as washing their hands and brushing their teeth. But one of the things we changed during the time I was there because of obesity is we served the food, and they got the appropriate serving, not serving themselves. And I know parents were really worried about their kids not getting enough to eat. And a lot of these children were already having food insecurity. So they were, you know, hoarding it in their pockets and things like that. But we found that they learned to eat their food. They were much better did after they came in than, you know, hungry instead of just nibbling all day long. So I think, because I was health and nutrition supervisor, so we did have a dietitian too, that before our kids graduated, we got, I'm trying to remember what that website was. I used it all the time, but they had a really nice handout. And of course, we tried to educate our parents because a lot of them were working in 2 or 3 jobs, they, you know, limited income or very much poverty level. But there was a really nice handout on packing your child's lunch, and it was preparing them to go into the school system, into preschool. And they had some really nice tips. And of course, some of the kids, because of the way they got what they got at our program, would choose the fruit over of course we didn't serve potato chips, but you know, it is helping. It was almost like a family education as well as a child education. It was a really nice rounded program. A lot of tips to give children and their families. So I think you're right, helping them to know why a choice is better. But a lot of times it's also helping them to have those choices. And so many of our families, unfortunately, the bad foods are cheaper.
It's true. I think some schools have really become progressive, and that they have children who do gardening and who harvest their own food at the school, which I have always thought was an excellent way to teach kids life skills, responsibility, and healthy eating. And I wish that that was incorporated into every school. I wish it was kind of mandated for schools throughout the United States to have kids grow gardens, you know, whenever their growing season is at school, and to harvest it and use it for their lunches instead of, you know, these lunches that are purchased that are cheap and high in carb. And that's really, you know, teaching them the wrong way to eat, and then having vending machines and candy carts in schools. It's just, we're really doing a disservice to children and teaching them how to eat that way. I mean, our school's amazing, but I purposefully asked our school not to serve juice to my children. I mean, they don't drink juice. And so for them to have it at school, they were guzzling it. And I didn't know that until, you know, it just came out one day when I was talking to my son, and I was like, well, I don't want you to drink 3 cups of apple juice a day. Like, I don't want you to do that. I give you milk and water at home for a reason. So, you know, just small things that I think could make a really big impact in schools. It's a good struggle, but it's a struggle.
I remember I watched this video, I think it was a community in Japan where the students would actually grow their own fruits and vegetables in the garden, like their own grains and everything. And like you said, Dr. Giordano, it's great life lessons too, you know, along with healthy eating and everything. So it's really interesting. I totally agree.
And I mean, especially in West Virginia. Oh, I'm sorry. Were you?
No, I was just going to say they're so proud. I grew this tomato, or I grew this. So they're so proud to eat that as well.
Yeah, especially in West Virginia, we are such a we have a lot of poverty in our state, and we have these areas that are called food deserts, which doesn't mean there's a lack of food. It means that there is a lack of healthy food that's available to people to be able to walk to or purchase. So that means that in like some zip codes in West Virginia, even if you wanted to go buy an apple, it's not within reach, you know, without a car or without somebody driving you and 2 hours to get to a specific grocery store. And so they have like convenience stores that sell chips and pork rinds and stuff, and people are living off of, you know, high carb foods in these so-called food deserts. So I think it would also serve to teach youth how to garden and grow fresh vegetables so that they don't have to rely on their going to a grocery store that sometimes they can't get to, or they don't have access to, or that doesn't exist within their zip code or their area.
Absolutely. And I really appreciate you saying earlier too in the conversation with the whole education, and Donna, you also mentioned like the whole family well-rounded education, because it does go back to like the household and everything too. So education is a huge portion of that prevention piece.
Yeah, absolutely. Absolutely.
Thank you all so much. Were there any other comments or stories you'd like to share with us? We have about 25 more minutes, but I don't want to cut it short or keep you guys here longer than we have to. It's totally up to you guys. All right, well, this has been so wonderful. I always enjoy having these great discussions and learning so much from you, Dr. Giordano. Thank you so much for that awesome didactic.
Oh, thank you.
Thank you. So a couple housekeeping announcements. Our next session will be on November 11th, and Jessica Perini is providing the didactic on hypothyroidism. So keep an eye out for that reminder. I'll be sending it out about a week before and everything. So thank you all so much. This has been wonderful, and have a wonderful rest of your day.
You too. Thank you.
Thank you.